This animation shows degenerative lumbar scoliosis corrected using low-stress translational forces with the 3DX system. 3DX screws are placed through the pedicles and into the vertebral bodies at the important vertebrae that are going to be instrumented. Notice that there are iliac screws in the side of the pelvis. What we're showing here is the results of inner body fusions with an inner body cage placed eccentrically toward the right side to help level those lowest two vertebral segments. Then, with the translational technique, it's important to bend the rod like you want the spine to look. So putting enough arch in the low back to correct the sagittal plane and correct the scoliosis also. Once the rod is placed, just sliding it down over those posts of the 3DX screws, it can be slid into the iliac screw. Notice the distance between the rod and the spine. This is how correction occurs. So you take this quick-threaded driver, squeezing the driver, sliding it past the threads on the post, and then releasing it and turning it. As it turns, it pulls that screw and consequently that vertebral body over to the rod. So you're literally pulling the spine to the rod, which corrects the spine in the coronal plane, or in other words, the scoliosis, but it also corrects the spine in the sagittal plane. You go back and just incrementally, gradually, one at a time, slowly tighten each of those connectors, pulling the spine over a little bit at a time, over time, spreading the stress of the correction over multiple points of fixation. Once the first rod is placed, then attention can be turned to the second rod. The second rod is actually a second chance to get additional correction. So that rod also is bent to the desired contour. It can be placed in an iliac screw, the same as the first rod was. This gives more strength to the lowest part of the instrumentation. Once that lowest part is connected and in place, the S1 connector is locked tight, and then the same thing happens again. These unidirectional rod crimps are placed over the posts, and incrementally, gradually, with low stress on each screw, these are gently pulled back into place, correcting the coronal plane, the sagittal plane, and the rotational plane, all by pulling the vertebra to the rod. The time that it takes to do this is anywhere from 5 to 30 minutes. Once the rods are placed, the set screws are tightened, locking the posts onto the rod. The rod crimps can then be removed, and the posts themselves can be removed. A cross linkage can be placed in between the two rods, effectively locking all points of fixation together and spreading the stress. Bone graft is applied, which will fuse the spine in this new straightened posture, and that's how degenerative scoliosis is corrected.